Most people believe that danger comes from obvious things, from chemicals with complicated names, or medicines that sound powerful and intimidating. But what if the real danger sometimes hides behind a softer word? A word that feels comforting, harmless, and even healthy? What if the word natural is not always the protection people believe it to be? Every day, thousands of people reach for herbal supplements, thinking they are helping their bodies heal, strengthen, and recover. They trust the labels that promise energy, detoxification, immunity, and vitality. The packaging often looks peaceful, filled with images of green leaves, roots, and flowers, giving the impression that these products come straight from nature and therefore must be gentle on the body. Yet for individuals living with chronic kidney disease, this belief can quietly become a dangerous misunderstanding. The kidneys are extraordinary organs that work day and night without rest, filtering waste, balancing minerals, and protecting the body from toxins that build up in the bloodstream. But when kidney function is already weakened, even small additional stress can slowly push these organs closer to failure. Many people do not realize that some herbal supplements contain compounds that the kidneys struggle to process. These substances may accumulate in the body, increasing the burden on organs that are already working harder than they should. This is where awareness becomes not just helpful, but essential. The truth is that the word natural does not automatically mean safe, especially for those who are protecting fragile kidney function. In the world of kidney health education, experts like Dr. Mathew R. Weir have long emphasized the importance of understanding everything that enters the body. Dr. Mathew R. Weir has repeatedly reminded patients and caregivers that protecting kidney health requires attention not only to prescription medications, but also to over-the-counter supplements and herbal products that often escape proper medical supervision. Many individuals living with CKD carefully follow dietary guidelines, limit sodium, control blood pressure, and attend medical appointments faithfully, yet unknowingly take supplements that quietly place additional pressure on their kidneys. The challenge is that these products are widely available, marketed aggressively, and often recommended casually by friends, advertisements, or online influencers who may not fully understand the risks involved. For someone with healthy kidneys, the body may handle certain herbal substances without noticeable consequences. But for someone whose kidneys are already struggling to filter toxins efficiently, even a small imbalance can slowly change the course of their health journey. Imagine a filtration system that is already partially blocked, already working beyond its intended capacity. Now imagine adding more substances that must pass through that system every single day. Over time, the pressure builds. Waste products linger longer in the bloodstream. Chemical balances begin to shift, and slowly, silently, kidney function may decline faster than expected. What makes this situation even more concerning is that the damage may not appear immediately. There are often no early warning signs, no sudden alarms that something is going wrong. Instead, the process can be gradual, subtle, and almost invisible until medical tests reveal that kidney function has dropped further than anticipated. This is why awareness is so powerful. Knowledge can change choices, and choices can protect health. Understanding the hidden risks behind certain herbal supplements allows individuals with CKD to make safer decisions and preserve the kidney function they still have. The message is not meant to create fear, but rather to encourage wisdom, curiosity, and careful consideration before adding anything new to the body's delicate balance. The kidneys deserve that respect, because every day they continue to fight quietly for the body's stability, even when their strength is already reduced. And when people begin to understand how easily those hard-working organs can be overwhelmed, they also begin to realize that protecting kidney health requires more than good intentions. It requires awareness, patience, and the courage to question what appears harmless on the surface. As the journey toward protecting kidney health continues, an uncomfortable question begins to rise in the mind. What if the very things people trust the most are sometimes the ones quietly creating harm? This is where the story becomes more complicated, and perhaps even a little unsettling. Many individuals living with chronic kidney disease do everything they are told to do. They watch their diet carefully, reduce salt, monitor blood pressure, take prescribed medications responsibly, and attend regular medical checkups. They make sacrifices to protect the small but precious amount of kidney function they still have. Yet in the middle of all this discipline and care, a hidden factor may slowly interfere with their efforts. The shelves of health stores and online marketplaces are filled with bottles promising natural healing. Words like cleanse, detox, boost, and restore appear again and again, creating the impression that these products can support the body in powerful ways. For someone hoping to protect their kidneys and improve their well-being, these promises can sound hopeful and reassuring. But what many people do not realize is that the body does not evaluate substances based on marketing language. The kidneys do not recognize the word natural as a sign of safety. They only recognize chemical compounds that must be filtered, processed, and eliminated. This is where the real challenge begins. Some herbal supplements contain concentrated plant chemicals that may be difficult for weakened kidneys to filter properly. Over time, these compounds can accumulate, placing additional stress on organs that are already working at their limits. The danger is not always dramatic or immediate. Instead, it can unfold quietly, slowly building pressure within the body, while everything appears normal on the surface. Dr. Mathew R. Weir has often emphasized in educational discussions that protecting kidney function requires a deeper awareness of everything that enters the body. Dr. Mathew R. Weir reminds patients that even products sold without a prescription can still influence kidney health in powerful ways. Unfortunately, many supplements are not tested with the same strict medical standards as prescription medications, meaning their long-term effects on people with kidney disease may not always be fully understood. This uncertainty creates a silent risk. A person may take a supplement every day, believing it is strengthening their body, while in reality, it may be slowly increasing the burden on their kidneys. The suspense in this situation lies in the fact that the warning signs are rarely obvious at first. Kidney damage does not always cause pain. There may be no immediate discomfort, no clear signal that something is wrong. Life continues normally, routines remain the same, and months may pass without any noticeable symptoms. Then one day, a routine medical test reveals a change. Kidney filtration numbers may have dropped, waste levels in the blood may have increased, and suddenly a quiet question appears. What changed? Sometimes the answer can be traced back to a simple bottle of herbal supplements that seemed harmless when it was first purchased. This realization can feel frustrating and confusing, especially for someone who believed they were doing something beneficial for their health. But this moment of discovery can also become a turning point. Awareness begins to replace assumption. Curiosity replaces blind trust. Instead of automatically accepting every product labeled as natural, individuals begin to ask deeper questions. Where did this supplement come from? Has it been studied in people with kidney disease? Could it interact with medications or place additional strain on already weakened kidneys? These questions do not come from fear. They come from wisdom. Protecting kidney health is not only about avoiding obvious dangers, it is also about recognizing subtle risks that hide behind friendly packaging and persuasive advertising. When people begin to understand this truth, they become stronger guardians of their own health. They realize that every decision, every product, and every supplement has the potential to influence the delicate balance inside their bodies. And once that awareness grows, it becomes much harder for hidden risks to remain invisible. The most powerful realization in any health journey often comes from a simple but profound truth. The body is always responding to what we give it. Every choice, every habit, every substance that enters the body becomes part of a larger story that shapes our future well-being. For individuals living with chronic kidney disease, this truth carries even greater weight. The kidneys are not organs that ask for attention loudly. They work quietly, patiently, filtering blood every minute of every day, protecting the body from waste that would otherwise accumulate and cause harm. When kidney function begins to decline, the remaining strength of these organs becomes incredibly valuable. Every small effort to protect that remaining function becomes meaningful. This is why awareness about herbal supplements and natural products matters so much. The intention behind taking these products is usually positive. People want to feel stronger, healthier, and more in control of their health. They want to support their bodies with things that appear natural and gentle. But true protection of kidney health requires more than good intentions. It requires understanding, patience, and careful decision-making. When individuals begin to recognize that not every natural product is automatically safe for weakened kidneys, they take an important step toward protecting their future. Education becomes a shield, guiding people away from choices that may quietly cause harm. This message has been shared repeatedly in the teachings and discussions inspired by Dr. Mathew R. Weir. Dr. Mathew R. Weir has emphasized that managing kidney disease is not only about treating symptoms, but about protecting the delicate balance inside the body every single day. That balance can be influenced by many factors: diet, medications, hydration, blood pressure, and yes, even supplements that may seem harmless at first glance. When people learn to pause before adding a new supplement, to ask questions, to consult healthcare professionals, and to understand how each product may interact with their condition, they become active participants in protecting their own health. This awareness transforms the journey from one of uncertainty into one guided by wisdom. Instead of reacting to problems after they appear, individuals begin to prevent them before they grow. That shift in mindset is powerful. It turns knowledge into protection and awareness into long-term strength. For someone living with CKD, protecting kidney function is not about achieving perfection. It is about making thoughtful choices again and again, day after day, in ways that support the body rather than challenge it. It is about respecting the incredible work the kidneys continue to perform even when they are under strain. When people begin to view their health through this lens, every decision becomes meaningful. Reading labels becomes important. Asking medical professionals for advice becomes a wise habit rather than an inconvenience. Gradually, these small actions build a stronger foundation for long-term kidney health. The goal is not to live in fear of every product on a store shelf. The goal is to live with awareness, understanding that the body deserves careful consideration and respect. In the end, the most powerful protection often comes from the simplest principle: informed choices create healthier outcomes. When knowledge guides daily habits, the path forward becomes clearer and safer. And for those navigating the challenges of chronic kidney disease, that clarity can make an enormous difference in preserving the kidney function that remains. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.